A very good afternoon to everyone. It gives me immense pleasure to welcome you back to MAHSA webinar series, and I'm Samuel David, moderator for today's session. Today's webinar session will be on tech neck, looking into the musculoskeletal problems of the neck caused because of prolonged use of gadgets, which is inevitable in the current context. I would like to inform you regarding the house rules. If you have any queries, kindly drop your message in the comment section below and we will discuss about that during the question and answer session. If your questions are not selected during the question and answer session, be assured that our speaker will reply to your questions after the session is completed. Do remember to fill in the survey form, the link provided below. Kindly do fill the form so that we can provide the e-certificate. Your cooperation is much appreciated. Without further ado, I would like to introduce the speaker for today's webinar session, Mr. Suresh Samuel. He has over 19 years of working experience as a physiotherapist. He did his bachelor's in physiotherapy from Dr. MJ Medical University at India and graduated with a master's degree in musculoskeletal physiotherapy from University of South Australia. And he also holds a diploma in health and safety law from Dublin Business School. He has worked at various hospitals in Ireland and currently working as a musculoskeletal specialist, occupational health physiotherapist at Central London Community Healthcare, NHS Trust, United Kingdom. He is a member of the Irish Society of Chartered Physiotherapists and member of the Chartered Society of Physiotherapy. He is passionate about continuing professional development and sharing his experience and expertise in the field of musculoskeletal physiotherapy. Once again, it gives me immense pleasure to welcome Mr. Suresh Samuel, my longtime friend and expertise in musculoskeletal physiotherapy, to share his knowledge among us. Please take the floor, sir.
Thank you, Mr. Samuel Prem Kumar. Good to talk to you, and thank you for the invite, actually, to talk about TechNec. This is something I've actually worked on for a number of months, and it's come up now, and I'm really happy for this opportunity that you've given me to talk about TechNec and how it affects our body physically and mentally. As Samuel Premkar was saying, like, I work over here in occupational health, and my specialty is musculoskeletal, and I've got very particular interest on spinal problems like neck, thoracic, lumbar pain as well. So I chose this topic on TechNec 2020, given the pandemic we're experiencing, unfortunately, and a lot of people have started working from home, and how that affects our neck in various different ways. So if we can go to the presentation, what we'll do is I can actually go through what we're going to talk about, how this is affecting. Can you go to the presentation, please, Samuel? So what we're going to talk about, I'm going to give you some general statistics, some general introduction, and why is the statistics important. And we're going to look into the touchscreen technology as well, and a quick tour of our neck itself with bones, ligaments, muscles, how our neck is made of, and special interest with trapezius, which is one of the neck muscles, which has different fibers, and what would be the solution or how can we manage it from a physiotherapy point of view. Next slide, please. So what is TechNec? There you go. That's one of my colleagues' son, TechNec. Like our pandemic, this has affected everybody, all walks of life, all age group, male, female, workers, students, etc. Next slide, please. So nowadays, especially over the last few years, we started using technology. Let's say touchscreens, laptops, mobile gadgets, n number of technology. And how are you using it? Are we using it the right way? We'll find out. We're actually starting to use it more at the expense of our bodies. And any age group, I've got 80-year-old patient who listens to Alexa, would you believe, and she has a touchscreen technology. I've got 15-year-olds. I've been working as a physio for 20 odd years, and I've seen people with neck pain in their 30s, 40s, 50s, 60s, 70s. But now recently it's become younger and younger and younger. My youngest patient is 15-year-old with neck problems, would you believe? And why? We'll find out. And there are actually statistics, and there's research over here in the UK that where 25% of people use either tablets, laptop, etc., like every single day for work, for personal use, living room, bedroom, you name it, anywhere. And recently, only about 2% have started making telephone calls, would you believe? And maybe it's a generation gap, I don't know. Like we just type a lot, increasing again musculoskeletal risks for our problems, neck pain, fine motor muscles, like finger pain, hand pain, carpal tunnel syndrome, you name it. Next slide, please. In the UK in 2018, actually, I couldn't get the 2019 stats, so this is more kind of up to date. There were about 137 million working days lost due to sickness, injury. And these are range from like various different sickness, actually, ranging from musculoskeletal disorders to stress to physical health to gastro problems, etc., etc. And just with musculoskeletal problems, so we lost about 30 million working days. And the impact of bad health, like, not just impacts us as physically, it also impacts mentally, it also impacts our family members, like, etc., etc. There's loads. There's no stop to it. Sky's the limit. Next slide, please. And that's, again, a rough idea. I got these data from actually the Office of National Statistics over here in the UK. And again, you can see over there, like minor illness actually forms a huge part, whereas musculoskeletal problems ranging from neck, mid-back, low back problems, or RSI is another problem as well. I don't like to say like RSI, like repetitive strain injury. We could use different terminology, different technology, different terms for it. Like WRLULD is another one, like work-related upper limb disorder is another one. So that again forms a huge impact as well. Like, and then there's anxiety, stress. Not many people realize physical health, musculoskeletal health, or mental health, all are interlinked. Next slide, please. And why is it important? Why do we need to have a statistic? Why do we need any record of it? Because like private, public sector, we all need to know our employees and why they're off sick, and put in necessary measures, put in necessary guidelines, protocols, so that this doesn't happen again and again. And we lose a lot of productivity, we lose a lot of business due to people going off sick. And then there's litigations, then there's also other related problems as well. Like, so also to reduce any workplace risks. So these are the importance of statistics, so we can plan forward to avoid or to reduce the risks for any of the musculoskeletal problems that may arise. Next slide, please. So do we need it or don't need it? Why are we using the smart gadgets? Let's say phones, smartphones, tablets, computers, laptops. Laptops have now touch screens as well. Like, so we're using them for convenience, pretty fast connectivity. We always want to be in touch with everybody. Practical. People travel and work. People working from home. We don't have proper setup. Social. Nowadays, social media is a big thing, isn't it? Like every single minute you're on social media, how many likes, dislikes, etc., etc. What are we using them for? Simple. Phone. Very minimal. Not many people make physical phone calls. So selfies, storage, TV, viewing, gaming, People also, one thing what I've not mentioned over there is work. Now, especially ergonomics forms a huge part in our day-to-day life. Now, going back to the pandemic again, a lot of, I don't know how it's in Malaysia, like over here in the UK and Western countries, a lot of people started working from home. And it's a ticking time bomb, would you believe? Because we get into these bad posture, and you will know later on in the presentation what exactly is happening with home working, how our body works. Next slide, please. Roughly, that's a time ranging from morning 9 o'clock, some people even 7 o'clock. What device they use, do they use for, and where do they use it? It goes right into your bedtime as well. Like, so you're literally tied with your smartphone or your tablets or your laptop. Do you dock it? Do you use it correctly? We don't know. Next slide, please. So that's going back to the anatomical tour. So that's basically how our spine looks. We all have a lovely little S-shaped curve, but there's a number of factors we start losing that curve. So there could be natural wear and tear, degenerative changes, arthritic changes, or any other pathologies. And one of the top on the list with younger population, posture. If you look into the left side, we have a normal curve in the neck, which we can say lordosis. And then we have a bit of thoracic kyphosis. And then again, lower down, we have lumbar spine, which is the lower back. Again, that's a natural curve. So over the years, we actually reverse the curve. There's no 100% cure or magic fix for it, but how can we really manage it to maintain our natural curve? So what are the effects of reversing the curve? How are we going to put some pressure onto our body? We'll find it on the next slide. Next slide, please, Sam. Thank you. So that's your phone, your laptop, or your tablets, anything. So you can see, when compared with the last slide, how much of a pressure you put on your neck. Like the joint, the neck itself, if you think about a big, busy tunnel, busy motorway, from your brain, you get a lot of nerves, everything going down, and then from your heart, you've got blood vessels going up, then you've got your nerves. So that actually acts as a big, big tunnel. And you can imagine how busy of a junction it could be. So the more you keep bending forward, the more you flex. What's going to happen? You've got to put a lot of pressure onto the neck, and on the long term, it's going to affect. I tell all my patients, if you're going to see that finger, absolutely good, no problem at all. That's reversing the curve, guys. And is that good? No, it's not good. Is it hurting me now? No. But if I keep doing that, 5 years time, what's going to happen? It's the same thing there with your neck from that slide. As you can see, you put at least about like 50, 60 pounds of pressure. Already our head weighs a lot. For some people, big heads. But when you keep bending forward, you're moving a center of gravity and you're putting too much pressure onto your neck straight away. And that's no good. Next slide, please. I chose, like, again, there's loads of different muscles in our body. And again, within the neck itself, there's loads, deep neck flexors, there's longissimus thoracis, there's spinal capitis. Multifidus is a beautiful muscle, actually, which goes all the way from your lumbar spine, all the way onto your neck, head and neck. I chose trapezius, traps is trapped. Again, we have different fibers. There's upper, mid, and lower. So upper fibers, what does it do? Just shrug your shoulders up and down. Middle fibers just pulls your shoulder blades back, which is again important. If you think about it, all our activities are flexed nowadays. We keep bending over, going back to the reverse curve. iPad, iPhone, tablets, etc., etc., etc. We keep bending over. We don't really work our extension muscles. We don't paint the ceiling every day, which is one of the activities where you work your extension muscles. So again, there you go. That's traps over there. We've got a lower fibers. Again, that brings the shoulder blades back down again. So Next slide, please. Again, there's loads of different ways your trapezius muscles. I just chose one particular muscle again. There's plenty of different muscles. They all work different ways. They all have different functions and different origins. Trapezius I chose was one of the big boys, and they can cause a number of problems. Trapezitis, trapezius myalgia, there's trigger points, there's loads of different issues that can happen with the trapezius. Up until about 20 years ago, for example, cervicogenic headaches, people used to think, yes, that's either caused tumor, headaches are caused due to tumor, or again, through cervical spine, or if there's any other pathology. Sinus can cause headaches as well. But then what happened was they did a lot of research into this, opened up trapezius. They thought trapezius trigger points can cause headaches as well. So it is an important muscle, and it's simply characterized by stiffness, pain, or restricted movement, left and right, up and down, shoulder girdle movements. And what and why? Why does it happen? Job. Apart from our physical stress, apart from trauma, any kind of injury, our monotonous job, repetitive work, increased concentration, static posture. We don't move enough. Our body is not designed by God to sit down in one place too long. Our body is designed for movement. If we're going to sit there too long, we stiffen up. If we're going to stand too long, we stiffen up. So if you're going to sit there too long and you're concentrating, we get into the rounded shoulders, and that will again cause trapezius problems as well, like too much concentration, and it is affecting our working population nowadays. Going back to the gadgets, getting into the flexed habit and not moving enough. Obviously, like any problems, there's more research need to be done. There's more research exactly need to be done, as in, is this the only issue that's causing trapezius problems? Next slide, please. Funny enough, there is some evidence, like gender actually seems to play an important role with trapezius problem. Women get more neck pain, neck stiffness. And again, don't shoot the messenger. This is just like common on research. I'm not sexist or anything like that. There is some evidence, and the reasons: they concentrate too much, they sit down too much, they get stressed. I don't know. What is it characterized by? Like sudden onset of pain, or stiffness, or spasms, tightness, sometimes even headaches, occipital headaches, and also pain around the upper traps area, or again, postural imbalance. Like if they're tight too much, if they shrug the shoulders up too much, the number of people I've seen really, really tense with trap problems. Once you release the tension in the traps, the pain goes away, the stiffness goes away, the movement comes back. Next slide, please. Like any examination, we need to get a good subjective. So half the battle is in the subjective. It's like a detective work. Basically, you find out what exactly the problem is, like ranging from aggravating factors to easing factors. Can you sleep properly? And what your work habits are, how long do you sit in front of your computer, and is your computer properly set up? Or are you working off your laptop, which encourages poor working posture? You're getting into the flexed habit again. So you get a good, decent subjective, get your history sorted as well. Is anything sinister? And again, always concentrate if you're talking about upper quarter, like neck problems, trapezius problems, get into BBI, ask about 5Ds. If I'm going too technical, 5Ds like VBI is vertebrobasilar insufficiency. Like I mentioned earlier, from a heart, blood vessel goes up to your head and neck. And if there's any restriction around the cervicothoracic junction, that could again cause problems. 5Ds would be the dizziness, diplopia, dysarthria, dysphagia, or drop attacks. So these are some of the red flag questions. So you get a good subjective examination. Then obviously comes into your objective, where you talk about or check the active movement, the neck movements, the shoulder movements, elbow, check your muscle tone, check the power, strength, movement, length, everything. Obviously, we'll have to do a differential diagnosis as well. Like, so are we just dealing with classic only trapezius problem, which has become tight for n number of reasons? Or is there anything more to it? Is there any trigger points that's sending in headaches? Or is there thoracic outlet syndrome? Or is there any nerve trapped, like cervical radiculopathy, like lumbar spine, piriformis, etc.? Sciatic people are very aware of. Likewise, upper quarter, neck, we can get our nerves trapped, like radial nerve, medial nerve. There's different types of nerves. Nerves are like the electric wires of our body. Electric wires passes current. Nerves, anything pain, pins and needle, numbness, weakness, tingling, depending on which fibers are affected. So you get a good differential diagnosis. Obviously, you can use different outcome measures as well. Like, there's neck disability index, there's bone moth index. One of the common ones we use was VAS, visual analog scale. So there's different outcome measures. Why do you use it? Like, exactly, why do you use it? You need to find out the efficacy of your treatment. If you're planning something, putting up a management in place, let's say exercise or anything, you need to find out, did it work or not? That's where you use your outcome measures. Analysis. Obviously, what do you think the problem is? It's like your assessment, like it's like a story. So you've gone through your subjective, you've gone through your objective, and then you've gone through differential diagnosis, you've gone through outcome measures, and then now you come up to a conclusion where, oh, all right, this is what the main problem is, and this is how we're going to manage it. Next slide, please. Management. So I'll come back to exercise in a second. So obviously there's loads of different management for the trapezius problems, or your neck problems. Manual therapy, manipulation, mobilization, medical, pharmacological, muscle relaxants, electrical, TENS, IFT, there's plenty. Obviously, there needs to be some amount of psychosocial involvement as well. Like, people do get stressed. Why are you stressed? Are you stressed because of work? Are you stressed because of personal life? Are you stressed because of COVID and you're working at home with kids running around? So you need to look into that as well. I'm no expert in stress management, but at least if you know, if that's the problem, you know where to guide and what pathway to send your patient in. And then you've got your workplace adjustments as well. Like, workplace adjustments, are they working off their laptop? Which is a definite no. No, it's a duty of care of your employer over here in the UK to provide people with good workstation, as in you dock your laptop, work off your main screen, use a separate keyboard, use your separate mouse. So there's like loads of gadgets that you can use. If you have to work off your smart gadget, like your not iPhone, like if your smartphone or your tablets or anything like that, reduce the time, prepare a draft. Technology, use your voice control so that you're helping yourself not to use the fine, smaller muscles or getting into the poor posture. Fine motor muscles, small muscles get tired easily. Big muscles, big boys take a lot more. So reduce your time. Don't work any more than 20 minutes at a time. Have a mini micro break. Again, with the HSE law, health and safety law, if you're working off your laptop, you have to have mini micro breaks. If you're working in a static posture, good setup with proper screens, separate keyboard, separate mouse, again, mini micro breaks every hour at least. Get up, move away from your desk, have a glass of water. So you're reducing the effects of postural fatigue. So that's your workplace adjustments. Again, there's plenty of gadgets, different type of mouse, different keyboards. Going back to our exercise, strengthening, stretching, posture. Obviously, posture is really important. Like I said before, that finger, good posture, that reversed, no problem at all now. But in 5 years' time, it's going to hurt me badly. And then it's going to stiffen up. It's the same thing with posture, any part of our body. Spine, always remember a beautiful, lovely S-shaped curve that we all have. Stretching, always got to find a nice balance between strength and flexibility. So you need to have good flexibility. Again, we're not like, ballet dancers or gymnasts. Like, we're normal human beings. We just work every day. Some people come back and say, "Oh, I can't turn my neck any more than that." Hang on, that's how much you can move. That's good, flexible. You're not a gymnast. You're not a ballet dancer who trained from the age of 3 or 4, unless you're hypermobile or hyperjointed. So we all have a certain amount of movement. If you don't use it, you lose it. So make sure you even simple movements every day keeps the joint moving. That will also stretch the muscles out. Simple things. There's, again, plenty of different ways of stretching. If you're going into strengthening, always remember the SSSR, like triple SNR, like speed. How fast do you need to turn? How fast do you need to move? Speed is important because that actually activates some of the good big muscles. Your stability, the next S comes in with your deep neck flexors, like giving yourself a bit of a double chin, like that strength brings in the stability muscles, like I was talking earlier on, like the deep neck flexors. Multi-fit is such a beautiful muscle. It goes all the way from lower down up your neck extensors, which again will help in reducing neck pain. Strength, again, there's your traps, bigger muscles coming in. So I'm not saying we all need to have a six-pack and walk like Macho Man, nothing like that. No, we just need to make sure it works in the right way, the right muscle at the right time. I've seen people with six-pack and big traps still have neck problems, back problems. So it's the quality more than quantity. So you've got your speed, how fast you need to move. You've got your stability, like which your deep neck flexors are. You've got your big boys, the trapezius, for your strength. All of them should work together to help and support your spine. And then at the end of the day, relaxation. So SSSR. So you relax. If you're tightening up, that's going to cause a lot of problems. That'll again cause sometimes trigger points. Again, there's no proper evidence or research. They all need to be done. But there is evidence and research that trigger points can cause neck pain. And like if you're spazzing up, increase lactic acid formation. And that again builds in trigger point. Acupuncture is another management that I haven't mentioned over there, like dry needling, some people use, acupuncture they use, or injection therapy they use. So there's plenty of management, but those are all outside our remit. I would always concentrate on strengthening, stretching, and postural. So treat or try to prevent any of these. If nothing else happens, obviously there's other ways of, as I was saying, injection, medication, there's loads of different. Unfortunately, some people, surgery as well, like decompression surgeries for the neck to relieve the pressure off the traps. Next slide, please. So we kind of touched on this. Basically, if you're going to keep doing repeated movements, like I was saying about the SS and SR, your muscle needs to be strong enough. Basically, it's the ability to produce force, to lift your shoulder, to turn your neck. Early rehabilitation, which is really important, really keen. Like say, if we can prevent any of these, which will be great. But unfortunately, as I was saying earlier, there's no magic fix or magic cure. It's a work in progress. If you need a six-pack, we can't get it straight away. We've got to put the effort, time into it for it to happen. Also, early rehab and good, proper setup. That is more important. What we see is DSC, display screen equipment setup. Reduce smart gadgets use. Work off your main screen, separate keyboard, separate laptop. Keep your body moving. Next slide, please. Same thing. Always remember, assess your tasks. What task are you doing? I've seen traders working off multiple screens, 4 or 5 bankers. They're working off 4 or 5 screens. Some of them work off the spreadsheet. So what task? Where are you working? Are you working from an office setup? Or are you working from home? Or are you working in an airport? You're going to travel travel to work? Are you working at an airport? What kind of choice do you have? It's easy. If you're in office, definitely main screen, separate keyboard, separate mouse, good chair. Yes, chair is important as well, but again, you've got 50-pound chairs, you've got 1,000-pound chairs. People still have problems because they don't move. So choice and usage. What gadgets you have. If you're going to use smart gadget like tablets to work, reduce the usage. Use stylus. Rather than using a small finger, small movements, use a pen to tick. Use separate keyboard. Always remember head posture. That's no good. If you think about the first slide that showed you, the amount of weight that's going through your head, when you flex, you put an awful lot of pressure on that junction, cervicothoracic junction. That's massive. There's nerves, there's ligaments, there's arteries, veins, everything going. So if they get tight, if they get worn out, you're in for trouble. Next slide, please. Somewhere along the line, ranging, if you look into that, what's happened, classic picture of evolution. Somewhere along the line, in between, we were really good. Not much musculoskeletal problems we had. But now, there's evidence, loads of musculoskeletal problems, apart from any kind of traumatic or contact injury or sports injury. DSE, display screen equipment, like your workstation, forms a part of your life. And now that people are working from home, it's only increasing. It's, as I said earlier, it's a ticking time bomb. So always remember, when you're sitting, sit fully back into the chair, hips a bit higher, knees a bit lower, feet comfortably flat on the floor. So you start from your base. So when you have a hip a bit higher, knee a bit lower, straight away you maintain neutral pelvis, neutral lumbar spine, which is our low back. And then we work up higher up your thoracic spine. And then you have your neck in a neutral posture. So you start from bottom and then work your way up. Obviously, again, mind your head posture. Ensure the top of the screen is reasonably at eye level. However, if you're wearing varifocal glasses, that changes. It needs to be a bit low because you don't have to extend your spine too much to look down. When I say top of your screen, it's your active viewing screen. And then shoulders relax. I always say, if you've seen a pianist, a good pianist, when they play, they have the note in the front, their shoulders relaxed, elbows reasonably at 90, and they float their hand. Similar to using your keyboard, your mouse, to again reduce any effects of postural fatigue, reduce any effects of musculoskeletal problem, or reduce the risks. Use your docking station, take frequent breaks. Years ago when I was working in a bank, there was a trader, I was saying, your setup is not good, hang on, like, you got to move away from your desk, you're sitting there too long. At least every couple of minutes, 5 minutes, go away, have a little break, have a glass of water, come back. Because before you know, you're sitting there 3 hours without moving. And he said straight away, you're asking me to move away from my desk, have a break, and back again. This is within the law. I'm not asking them to do anything outside of the law, and legal framework in the UK agrees to it. And he said, that's half an hour gone off my working day, and I'm a banker. You know how much money I can make in that half an hour's time? I had no answer for him. He had a valid point. So I said, all right. So did my assessment, did all the setup, all the change. Before I left him, I said, imagine if you go out sick with neck pain for a week, how much money would you lose? That's when he thought, oops, yeah, makes sense. So sometimes you got to play fire with fire. So I'm not trying to scare anyone, but it's happened and I'm seeing it every day. So your posture, positioning, work habits has an effect on our body. So always, if you're using any hybrid device, try to dock in. Or if you're working from a main workstation, make sure you're sitting up straight. We're not machines, we're not robots. We can't be like that all the time. As I said, that's why you need to keep moving. Your best posture is your next posture. Next slide, please. There's a bit of reference over there. If you haven't taken anything from this, or if you just taken a couple of points, always remember, 1, keep your body moving. Our body is designed for movement. 2, your best posture is your next posture. And if there's anything, you can always feel free to ask questions. Next slide, please. So the take-home message, as I said, ensure that you keep your body moving, and always remember our body is designed for movement, and look after your posture. And when possible, use, or where possible, use your proper workstation, separate keyboard, separate mouse, monitor. But because now that people have started working from home a lot, it is increasing. And I can guarantee down the road, there will be a lot more musculoskeletal problems, any age group. Any questions or anything like the take-home message? Quality more than quantity.
Hello, Mr. Suresh. Thank you so much for the wonderful and insightful thoughts on musculoskeletal issues of the neck. So it has been a real eye opener how neck pain is affecting us in this modern world, how we are using our neck in a bad way, not in the right way. So the takeaway from your presentation, from your insightful presentation on your thoughts is how we have to use our neck in a proper way, how to avoid problems of the neck. So there's been really an eye opener and an insightful presentation for us. Um, so, Mr. Suresh, so as a physiotherapist, what will be your cardinal advice for us, for a layperson, for someone who is working for long hours? He is duty bound to work for long hours before a computer workstation. He cannot afford to not to work. He has to work for long hours before the computer screen for long hours. So, what will be your cardinal advice or your advice
As a
for?
physio,
Mhm.
thank you, Samuel. As a physio itself, like as I said, I worked in different areas of physiotherapy field, like ranging from geriatrics, care of the elderly, to sports injuries, to different areas. And now I'm kind of concentrating on occupational health, musculoskeletal issues happening in the workplace. I would always say frequent breaks is important. Change your posture, keep drinking plenty of fluids, and also work on your strength on your upper quarter, like your neck, shoulder muscles. They need to be strong. I'm not saying we need to build and have a six pack, nothing like that. If you're sitting up straight, if you're working your inner muscles, core, Pilates is fantastic. If you're working into those, actually, that will again help in reducing the risk. On top of that, ensure that you are not working off your laptop for extended periods. You're not working off your tablets or any other gadgets. So ensure that you are properly set up from a workstation point of view. Remember the pianist I was saying, when they play the piano, they're sitting up straight, have the note in the front, shoulders relaxed, elbows at 90. Similar to using a keyboard and mouse.
Thank you so much. So, could I kindly interrupt you? So, I would like to ask one more thought. So, you mentioned about the psychosocial dimension for the neck pain. There was one dimension that you mentioned, psychosocial. Could you just give us a few thoughts on that? On the
So
psychosocial component of neck
yes,
pain.
so basically, like any physical problems we have, like neck pain or back pain, that will affect our mental health. You were saying, Samuel, like, someone who can't afford not to work and he's been working in front of a computers, long hours, etc. If he goes off with neck pain, his mental health kicks in. What is he going to do without a job? How long will he get the sick pay? Will he get increasingly stressed? Will he get frustrated? Will that manifest onto his family, or if he has any family, or any other social issues that he might arise? Or if there's any trigger points in the trapezius muscle, if that's going to send in neck pain, or if it's going to send occipital headaches or temporal headaches, how is it going to affect him? So we'll also have to look into, as I was saying, I'm not a psychologist or a counselor. What we'll have to be aware of how that's affecting a person,
Okay,
and
okay, Mr. Suresh. Yeah,
hopefully
that was
try and
wonderful. Yeah.
guide them in the right direction.
Thank you so much for your wonderful insight on the psychosocial component. So now the floor is open for questions. Okay, audience could please ask any questions from a resource person, and he's there to answer your questions.
Yeah, there's a question. Cervical traction, yes. We don't over here in the UK use those electrical traction machines that we used to use years ago. There is evidence that cervical traction can help. And again, like any modality, it's multifactorial. So I wouldn't just stop with traction alone. I would, traction helps and there is evidence. I would also encourage posture, training the deep neck flexors and movement and some strengthening of your upper quarter muscles. There's a nice research, Chris Worsfold, he's done some research on it. And then there's also like from a Korean university, there's some research I've found out. Effects of, it's the latest one actually. Effects of lower trapezius strengthening exercise on pain, dysfunction, posture alignment, thickness, and contraction with patients with neck pain. It's an RCT, randomized controlled trial. So that's a good article. And yes, going to the question, traction can help. Yep. So having neck and shoulder pain, sometimes feeling numb on the hand, what kind of stretching can be done? Again, we need to get into a good subjective examination. So on the subjective examination, following on to your physical examination, if we find out there's nerve problems, like I said, like the pain, numbness, tingling could be due to the nerve. And there's n number of, so we'll have to find out, is it the radial nerve, the median nerve, or the ulnar nerve? These are common nerves that could send these pain, numb, or tingling sensation. So you can direct your stretches to stretch those nerves. For example, again, like retracting your shoulders back and then going towards one side, you move your neck and then you stretch out, it stretches the median nerve. So there's plenty of different stretches. Pillows is one thing. There's a company in Orlando specializing in special pillow that claims to be effective for neck problems. Do you know whether it's effective? That's a good question. Many people ask me those questions, my patient, and if you think about it, there's 100 different pillows in the market, X shape, V shape, Y shape, memory foam, you name it. And I ask them one question: do we sleep in one position? I don't personally. We twist, we turn, we lie on a side, we turn, we swing our body to the other side. So sometimes these funny shaped pillows may not be suitable or may not actually help you on the moment. So for me, I would just recommend one good top quality pillow. Nothing too fat, nothing too slow, or like say nothing too low, like funny feathers. And more importantly, one of my patients took my advice. Every Christmas shopping, top of her list was new pillow. So every year she changes the pillow. She hasn't had neck pain. I've only seen her a few times just for maintenance. So every year I change my pillows. One thing I wouldn't recommend is lying on your tummy prone, because when you lie on your tummy, you're automatically turning left or right, which is again going to increase the risk for neck problems.
Okay. I think there are no more questions on the floor for you, Mr. Suresh Samuel. That was a wonderful presentation, and there was wonderful answers to all the questions. So I would like to thank all the participants for their valuable time. Okay, you have taken your time to be with us, to be in the webinar, to get answers enlightened by our speaker from UK, Mr. Suresh Samuel, on the musculoskeletal problems of the neck. And it has been an enlightening experience for us to hear your lecture on this particular problem. So once again, we would like to thank you, Mr. Suresh Samuel, for your wonderful participation and for your wonderful thoughts and sharing your expertise on the musculoskeletal problems of the neck, and for kindly taking the questions and answering them based on your extensive clinical experience, both research and clinical. It's a pleasure to have you among us. It has been an honor and pleasure. Thank you once again. Thank you so much.
Thank you, guys. Thank you. I hope you enjoyed it and hope it was like informative. And thank you for the invite, Samuel Prem Kumar, and the MAHSA University as well. It's been a pleasure to talk to you guys.
Yeah.
Feedback
So,
or you can always tune into any social media.
yeah.
MAHSA
So,
wants to.
once again, dear participants who have given your valuable time to be with us on this webinar, please stay tuned to our social media on our Facebook web pages for more information. So, we are providing optimizing muscle flexibility and strength, an online course which will be of great help in clinical practice. So, do once again, I would like to emphasize, please stay tuned to our social media for more information regarding this. Okay. Once again, it has been a great pleasure and honor having Mr. Suresh among us and having you all, the participants, once who have given your valuable time to be with us for this webinar. Thank you so much. Have a wonderful evening.
Take care.
See you soon all.